What is cholesterol? When you think of cholesterol, you probably think of something that is bad for you. We want to make sure we watch our cholesterol, not eat too much of it, but what is it really? Join me as we talk about cholesterol in today's video. Hi, and welcome back to my channel, Learning Biology with Dr. Vanessa. I am so glad you are here to learn more about your health and how your body works. If you want to continue to learn more about your health, please make sure to subscribe to my channel if you haven't already done so. Thank you for your support. Disclaimer: the doctor in my name comes from the PhD I earned. I am not a medical doctor. My videos and content are for educational and informational purposes only. This is not to be used in lieu of medical advice, but to help educate you to learn more about your body. If you have a true medical emergency or issue, please see your physician. Cholesterol is actually a lipid that your body needs. Lipids fall into the same category as fats and are not soluble in water. This means that they can travel through the blood without breaking apart and get to where they need to go. Your liver actually makes all the cholesterol that your body needs, but you also get cholesterol from the foods that you eat. And naturally, your body has ways to get rid of this extra cholesterol, but when it gets overloaded by eating too much cholesterol, it may not work properly. So eating a diet that is high in cholesterol can lead to high circulating levels of cholesterol in the blood. Cholesterol itself isn't bad. It's actually used in the body, which we'll talk about soon. But bringing too much into the body can be. This is why it is important to watch the types of foods you eat and also to make sure you regularly test your blood to see what your cholesterol levels are. Let's talk about the function of cholesterol. As I mentioned before, cholesterol is necessary in the body. It has some very important functions. These include forming the membrane of the cell. All cells have a cell membrane, and this membrane helps to protect your cells and can control what enters and leaves the cell. And since your cells, many of them, live for a very long time, they constantly have to renew this membrane, so cholesterol is very important. Cholesterol is also a component of bile. Bile comes from the liver and then is concentrated in the gallbladder. And so bile is very necessary in digestion in order to digest fats in the foods that we eat. Cholesterol is also the base for many hormones, including sex hormones such as estrogen and testosterone, as well as vitamin D. So our bodies do use cholesterol, and cholesterol is necessary. Why does cholesterol matter? We've already talked about the fact that cholesterol is found in the blood and that the liver makes all you need. So any additional that you put in the body from your diet is cholesterol your body doesn't need. So if you eat a diet that is high in saturated or trans fats, it can raise your cholesterol. When the amount of cholesterol in your blood increases, so does the risk to your health. High cholesterol can contribute to higher risks of cardiovascular diseases such as heart disease and stroke. Cholesterol can join with other substances to form a thick, hard deposit on the inside of arteries. This substance eventually becomes what is known as plaque. When plaque builds up inside the arteries, this can narrow the arteries, making it more difficult for blood to flow through, which can also increase blood pressure. If a clot forms and then blocks one of these narrowed arteries, a heart attack or stroke can result. Getting your cholesterol tested and knowing your numbers can better help you understand if you may have high cholesterol. If you do, you can lower your numbers by diet and exercise and sometimes medication prescribed by your doctor if absolutely necessary. So let's quickly recap some key points from that. The first one, check your cholesterol numbers. Make sure you know what they are. It's important for you to see if you may be tending to higher cholesterol numbers or lower cholesterol numbers. Sometimes high cholesterol runs in families and you can't avoid it. Sometimes it's because you eat a good bit of takeout food. If you do have higher cholesterol numbers, change your diet and lifestyle to reduce your numbers. And finally, if you can't control your cholesterol with diet and lifestyle changes, then speak with your doctor to help control your cholesterol further. When you get your cholesterol tested, you will see it shows several different types of cholesterol. Among those are LDL, HDL, and VLDL. Let's talk about each one so that you better understand what your test is showing. LDL are low-density lipoproteins. These lipoproteins are made mostly of cholesterol. These are referred to as the bad cholesterol. LDLs are actually important to your body, but they become bad when you have too many circulating in your blood. These cholesterols can combine with other substances and build up those plaques we talked about before that can form in your arteries. This is the number you want to keep low. For most adults, this means keeping it below 100 milligrams per deciliter. If you have a history of atherosclerosis, it should be kept even lower. HDL is high-density lipoproteins. These lipoproteins are made mostly of protein. HDL is referred to as the good cholesterol. These take extra cholesterol out of your bloodstream and transports it to your liver. Your liver then breaks down the cholesterol and gets rid of it. You want to keep HDL levels high. This means that men should aim for at least 40 milligrams per deciliter and women for at least 50 milligrams per deciliter. VLDLs are very low-density lipoproteins. VLDLs carry triglycerides and cholesterol, and their protein content is low. These also fall into the bad cholesterol category because they can contribute to plaque buildup in your arteries. VLDL levels should not be more than 30 milligrams per deciliter. You also get a total cholesterol reading, and usually you want to keep that under 200 milligrams per deciliter, but you really want to look at this breakdown of the difference between LDL, HDL, and VLDLs. LDL and VLDLs are your bad cholesterols. Your HDL are your good cholesterols. No matter whether we put them in the good or bad category, they are all important in the body at different amounts. I hope this video helped you to better understand cholesterol and what it does in the body. In the future, I will make more videos discussing more components in the blood and even delve deeper into cholesterol and cholesterol levels because there's a lot more that we can talk about. This is basically an intro video so that you can try to understand and get a grasp of what it really means to have high cholesterol. It is important to make sure you are getting your levels tested at least once a year, especially if you are at risk, and that you know your risks. If your cholesterol is high, you can work towards lowering your cholesterol. If your cholesterol is high, you then have a higher risk for things like heart disease and stroke, and if that runs in your family, you really want to be able to make sure that you are able to control your cholesterol and know those numbers. If you have any comments or questions, please make sure to put them in the comment box below. If you haven't already, please subscribe to my channel so that you can continue to learn more about your body and how it works. Thank you.